So a new study has found that a double-digit drop in the diagnosis of the 8 most common cancers, all because people skipped routine screenings during the pandemic. We all know that early detection is key. It's the best way to improve health outcomes and chances of survival. Let's talk more about this very issue with Dr. Harvey Kaufman. He is the Senior Medical Director, head of the Health Trends Research Program at Quest Diagnosis. Dr. Kaufman, how are you?
Wonderful. Thank you, Andrew. Great to be here.
Beautiful. Yes, yes. So why was this all delayed? Was it because of the pandemic and people just concerned about being in doctors' offices, that sort of thing?
Exactly, Andrew. So just think about when we woke up this morning, we didn't think, I got to talk about cancer, but we did wake up saying, how can I have a great day? How can I live a long, healthy life? How can I reduce my risk for cancer? How, if I had cancer, how can I have it detected at an early stage where it's most likely to be cured? And that's what this story is really about. So this study, the Quest Diagnostic Health Trends study, published in the Journal of Clinical Oncology, Clinical Care Informatics, we looked at 1.1 million people who were newly identified with cancer in the Quest Diagnostics database, largest study of its kind, starting from January of 2019 onward. And the early months of the pandemic, March, April, May, when we didn't know much about the virus and a lot of healthcare was closed, we were looking for toilet paper, guess what? Cancer diagnostics plunged by 30%. When we look at the next period, cancer diagnosis didn't increase, rather they stayed down. They were down 15% relative to before the pandemic. And then we added one more year, the most recent year, instead of a rebound, they were still down 11%. So this is a massive decrease in the number of people who were newly identified with cancer because COVID-19 didn't cure cancer, cancer didn't take a pause, and as you stated, we did. We took a pause.
It's all very interesting and sad, really. I mean, from what I understand, up to 200,000 people just in 2022 alone missed the cancer diagnosis. Is that right?
That's right. So if we think about that each year, there's about 1.9 million people who are newly diagnosed with cancer. That's a pre-pandemic number. We multiply that by 11%, we get 200,000 people, and that's in 1 year. If we think that the pandemic's been going on for 2.5 years, we can extrapolate that to say that there's about 500,000 people, in addition to the usual burden of people who are newly identified with cancer, an additional 500,000 people are out there with cancer because of decisions to defer or skip cancer screenings.
Oh, that breaks my heart to know that the pandemic is responsible for yet another awful situation when it comes to our country's health, when it comes to just the overall vitality of the American family. So, which cancer screenings are most important, and what's the best way, when, and how to get them? Let's talk about that first and foremost.
Sure. Well, in the study, we looked at 8 common cancers. We looked at lung, breast, colorectal, and prostate. Those 4 alone account for 50% of cancers. And then we looked at 4 additional cancers. The usual way that we look for breast cancer is through mammograms. Colorectal cancer screening can be through home testing, blood test, or colonoscopies. And there's other screenings for other cancers. The way to get information is to ask one's doctor. We trust our doctors. Go to the American Cancer Society website, cancer.org.
Okay,
another place for
go ahead. Go ahead, doctor.
Another source, Andrew, is to go to a source from Quest Diagnostics, because some cancers are passed on by genes that we inherit from our parents. These are hereditary type cancers. And one can take a free online quiz at questhereditarycancer.com, questhereditarycancer.com, because we want to wake up tomorrow morning saying, how am I going to have a great day? How am I going to live a long, healthy life? And the answer to that is to reduce one's risk for cancer. And if one were to have cancer, to have early detection, to have the best chance for cure. And that means taking action, making that appointment, so that we can fulfill our dreams for for Christmas and any other holiday that we celebrate.
At what point do we say to our doctor, okay, I need a cancer screening? Is it something that we should do every year? Is it something if we feel a certain way? What's your best advice?
Well, for people who have symptoms of any sort, absolutely talk to one's doctor. There's many resources available because the screening guidelines vary based on our age, our sex, and other risk factors. So the American Cancer website, cancer.org, is a great source. But talking to a healthcare provider, talking to our doctor is also a great source because we generally trust our doctors.
Anything else you can provide in terms of, maybe help out there for some patients that are kind of on the border? I mean, I understand there's a quiz out there that people online can take, and that may kind of help them a little bit.
Yeah, I think the answer is to go ahead and talk to one's family, talk to one's friends and community to make sure that we are all engaged and re-engaged with our healthcare system. And I'll just repeat again the website for hereditary cancers. It's a free online quiz from Quest Diagnostics at questhereditarycancer.com.
All right, Dr. Harvey Kaufman, we appreciate you and your analysis here, and hopefully we can get people on the right track and get them tested early for that early detection. We appreciate your time.
Thank you, Andrew.